even the issue on the table today for discussion will have a headway in the next few months to come. So we've conducted series of vaccination. If we all can remember, vaccination in this country started March 10, 2001, with a very high political support. It was launched nationally by the Honorable President of the Republic of the Gambia, and this was cascaded to all the regional administrative regions, where the support of our governors were crucial, and it serves as a moral support to our staffs and also to the population to enhance vaccination uptake. And through the period, I think as a country, the initial target was for us to vaccinate at least 70% of our population. And we've struggled very hard, though we've not been able to reach the 70% target, but at least we have vaccinated up to 22.5 to 23% of our population with the primary series. When we said primary series, means those who received their complete dose. And we've also had others that were vaccinated with boosters. And still our focus remains. You know, when vaccine was available, even with a small quantity, through WHO guidance, and country tailored this to their national system, we had priority people. This is our elderly, 65 years and above, those with comorbidities like diseases like hypertension, diabetes, cancers, and the rest. We have our health workers. We have our teachers, those security and others. So the struggle still continues for us to get all these people, especially the ones who have led the high priority, to have 100% vaccination throughout the period, so that every member of the population that falls within this category is vaccinated 100% with the primary series, and can even have a booster vaccination in 4 to 6 months, so that the immune system are strengthened to fight against COVID-19. So I think in short, I think we could not vaccinate up to 70%, but we really appreciate the support we get out there from our population. We know it's not easy, but the population is very, very supportive, and we still continue to strive to vaccinate more and more within the population. Thank you.
I think despite the challenges, it is important really to acknowledge some of the achievements that we have collectively been able to achieve. But let me have both of you at least add to what is just said.
Yes. Badi ma kamen for tenting doro. Wolom ni nata impengola tenting Gambia jamanga kukutati. Gambia don ni nata pengola hanin na indandang wala ja wolon Senegal Guinea Bissau mange ko malankati wolto. Mo nyaton kollati ni nata pengola jam. So amanga kukutati coming wokata kelngol doro nim banko mol dalta kaminke. Comme nyaji be nunto sasa jama bija etijang mine wotinna nyimpengola atinna so sasa nata kulle tarje milia sartu tarje milia lonko ikala pour ka sasa nyinkele so Gambia jan tol sembu ba minti wolon ka sasa nyim fongo be tankande so min kam mako yo wala baake wolon nyim vaccination di ka pengolia milia lonko katare ke di dinne wala tende so coronavirus min keda covid-19 ufana nata wo sasal le kon sasal mi alon ko iman toro warta andum nga jorangol so mi yanke be kala kan so wala tinna Ministry of Health ye campaign jamake wolon ka findi mol kan ke pengu rawo ko min dara fo 9 to 10 rawo mi alon ko ministry yake wo be pour ka mol tankandi bare nga jele ko nga mol tankandi nya nyanta kata kuwol ni la falal so wala tinna saying nin strategy do nata mi atinna vaccine abatara available in anytime to pour mol min yalon ko iba sulalala ha so wala tinna bin nata jan nim mol yoko kata bayo nyaaje jata kendia bunda Gambia ja Ministry of Health level so ntolfana mim mun hamoto wolon sasa fa mo kana so so ntol sembu ba min de wolon kamobe tankandi ni sasala so ken o nyami wolon nyim pengoti so wala tinna bi nata nanja pour nim banko dingo le kacha soto e pengo nyina iba tala nyami ani ba tala damin.
Camera?
Yes, thank you very much. Good evening, viewers. Just to add on what Mamande mentioned, we definitely appreciate the contributions of everybody, include our global partners, WHO, the UNICEF, the World Bank, for having supported the Ministry of Health and Government efforts all through since the establishments of the vaccination deployment strategies and the subsequent vaccination campaign to date. Of course, today's sessions, like mentioned, through supported by the UNICEF with the support of the government of Japan. This is a demonstration of the continuous support that our partners continue render as the country battles global and national challenges and contributing its quotas also to addressing health challenges. Like Mamanding mentioned, we had several rounds, and all because the country has a vision. We wanted to, initially it was the global envisions to at least each country to vaccinate at 70%, because that was what was envisaged. Once we get that, we'll be able to bring down the transmission. God been so good, as we get into the second year of the vaccinations, I mean, cases started dropping. If in our country context, a lot of vaccination happens. I mean, we vaccinate close to, if you look at all together, over 500, 700,000 population people vaccinated. That's a huge number. Despite that was not what our intention. But it's appreciated. But now, as he mentioned, the new focus is what do we do? Considering the global focus as a country and as a ministry moving forward, the global focus is now integration. When we talk about integrations, this is not the new time. This is something new. Most of these measles vaccinations, yellow fever vaccinations happening, meningitis, all started the same way. When there are pandemics, and then there are a lot of efforts of vaccination, and then they're able to bring down the transmission to a certain level and to control, and then it continue routines, because the world succeed only in bringing eradication one single disease condition so far. That is smallpox. It means COVID is here. We are here because COVID is still here. We are here because we have to continue, as the tradition is. After some times, all these big vaccinations initiative that arose in the past have to continue in the routine. So that's what we call integrations. Now the global focus is that to government to come up with strategies, or Ministry of Health, to be able to give the vaccines routine. But when the routine, just like this nurse, it's very common.
Yes.
Every month, everywhere in the country, people go to nurse. Yes. We have over 760 sessions with Gambians across the country. A lot of sessions, both public and private, countrywide, every month. So now the focus is that we have already developed strategies to ensure that the people can get the vaccination everywhere they go. So we are here because we have a public health problem. The problem is COVID is still here, and the solution is people need to get vaccination. And the focus is like every individual age 12 above should still have their primary doses, despite at this moment primary dose. When they get their first booster, now the continuation focus WHO by WHO guidance is the high priority, people of the high priorities. You understand, people, the elderly, you understand, the health workers, and the people with comorbidities, that people who have underlying disease conditions, most vulnerable. When you, for example, you have hypertension, you have sugar, you have diabetes, you have cancer, you have. These are people who their immune system is easily compromised, and when they get the COVID, it becomes the same. So, like the routine immunization happening, the focus is now. We are going to continue with the vaccination, and we want the population also to support these missions. Now, every health facilities, we have our 85 public health facilities countrywide, where routine immunization is is conducted. Now, these facilities will now conduct vaccination routinely, meaning in every outreach, in every clinics, and other special clinics like the NCDs, non-communicable disease clinics we have. Vaccination will continue in those sessions. It means as they come routinely for their other clinical orientations or consultation, they can also have their vaccination. But now at the community level, as we go out in the outreach, outreach, like hardly people go for 5 kilometers in this country without having a session plan for health workers to come in contact with people for preventive services. That's what we call outreach. So now the target is, as we go out in our outreach, we also expect the population around to come, to come to this service. Our health workers, inshallah, strategies are in place. They'll be oriented more and they will be supported to the possible means to be with those vaccines each time they go out, and so that the people also come out and take those vaccines. This is what we mean. Because, everything is dwindling. Global focus change. Once there are big problems, bigger problem, a lot of focus, resource-wise, you understand, a lot of effort. Now, we believe with these strategies, we can get our population vaccinated. Moving forward this way, we will continue a successful vaccination countrywide.
Okay, so let me engage Mamadou now and for this strategy that Kamara has just highlighted some of it. Going forward, what really is the focus now, and how do you intend to ensure that people are still able to access these vaccines, but also encourage them to come forward, those that are yet to take their vaccines?
Yeah, thank you so much. I think having this panel discussion today is one way informing the population. We last conducted our last campaign, I think some few months ago, and they've not seen us active in the population, vaccinating, moving from one strategic location to the other. And one might think, oh, COVID is over, because I'm not seeing any vaccination team. But we are assuring them that COVID is still around, within and outside the Gambia, and we need to continue our efforts to be vaccinated. As Musa said, most of the pandemic started with active vaccination campaigns. But as you control the disease to a reasonable level, you'll want to slowly integrate it into the routine. So what we want is a one-stop center for all the population. We want, as Mamanding, will get dressed on a Monday, get dressed my child, carry my child on my back, walk 3 kilometers to an outreach in Somita. I want the person that needs the vaccination team to prepare himself, walk to the health facility and get the vaccination. You will understand. So we have to know that vaccines are available at all public health facilities. And even our thinking as a ministry is to identify private health facilities. As they give routine vaccination, they will equally give COVID-19 vaccination, because health is a choice. You choose to go to a public facility, but those who choose to go to private facilities should equally have opportunity to receive their vaccination.
I think it's important that you have this very inclusive strategy.
Yes.
You are quite right. You have a lot of people as well who also go to private health facilities. So this is important.
So it's going to be a package. Like he said, even the specialized clinics will want them to have at least COVID-19 vaccination with them. Once you are screened, you've taken your other medication, you've seen doctors, and even the last one of the campaigns, we even involved the medical doctors, where we attach a vaccination team, and anyone that comes to that specialized clinic will be screened. You do your routine checkups, doctor is done, and doctor will refer you to a vaccination site to take your vaccination. And we need to appreciate our medical doctors. They've really added value to what we were doing. And especially our comorbidities. As I said, elderly, comorbidity, health workers, these are high priorities. And we've seen a massive increase in terms of vaccination uptake among them. So this is what we want, because we know campaigns are demanding and sustainability as a country. You know, most of our endeavors are through partner support, which is added onto the support of the government. But we know we have so many developmental agendas, and we need to move side by side. So we cannot shift all our focus on health. We need other areas as a government. So we want to think in this direction to see how best and how strategic our population can have access to this vaccine and make use of it, instead of us moving, you know, the resources, the time, you know, is demanding. So please be rest assured, vaccines are available in country. You can go to any nearest facility, public health facilities, receive your vaccination. And Mr. Nyansi will be here when strategies are laid. We'll come back and inform the population, either QTV or other media outlets or our other strategies to inform the population. Even if you walk to Afirmed today, please be assured, when you ask for COVID-19 vaccination, you can have it. So we put in all those strategies, but we have to see our employers, I would say, because they matters. The population matters in our work. So this is why we are here, to discuss, at least to give them a gist of what is going to happen, so that they will also think around and make their informed decision before the due date is. But even today, if you need COVID-19 vaccination, for now, kindly go to any public health facility closer to you. You will be serviced, inshallah.
JT.
Okay, coming Mamandia Nyamani Musadoro. Campaign on Nil saying Ajoko what campaign what Aqualiata. So coming cool Bakela Nyaming, along Ministry of Health, after COVID vaccine or available in a Tarasutorum Purmobe. So Minister of Health Balafiri wala pura Tarasutorum Mobe. So after Minakela saying, after Minakela Dora Wolom, COVID vaccine more Gambia jang iba Gambia jang imu Gambia dingot imang Gambia not iba Bangkoka. It just sanji tanim flash do karasado. Inyantaka COVID vaccine 2 dose at least inyanta wotala. I bet you later booster that, but 2 dose inyantaka wotala. It also told Ibo Talam to be a Gambia left town on Miliango, Janjan in Banko Bega. Iba Sharine, because village itata ibatarako vaccine biel vaccine jeni kana jamu sia but sia kweta mo jama ku jama fo da vaccine la ko do oltije comme ngafu nu njabe mol mi vaccine ta abasutiala mo wuli keme wala anin fe so ni atara vaccine ka mo fa ta dum gambia banda ko so ku jama vaccine ko saying wol moli alna ko mangi to nyaade sa min biye do wolom ba fo mol bitala dami ba vaccine wol tala dami. So comme mama ndi wala fotenting comme clinique jama ko soto gabbe janna docteur wol ning na no sol mi balle tan wol to e ka clinique ko conduct mo le mili alon ko sa do le bela milange kata routine check up wala every time so wo clinique wol ba target lale pour wo mol mili alon ko e sukura wol bela yela selol bela high blood pressure wala yela selol ni courant dol bela mili alon ko diabetes sukuro wol bela wo mari nyanta katalele COVID vaccine e continue kata anin leptando kula because leptando kula it will most of the time in sakato la ranyo anu sakato du ngalon ne e bala soja ro kajile so wala na beti ada pour leptando kula fana ye nyinta so ni sakato dol comme ngamil foe mol fana bal soja ro kajile so wala na mata bagel pour o mol ngamil foe tande mi yalon ko diabetes be wala sukuroti yela selo high blood anin asifa nyo jamal mi yalon ko in sasa jama bela pour yeta ya kata wato wati ikela schedule follow ko bi nyaafu nyaam ni COVID vaccine follow ta ka fully primary dose fully vaccinated but WHO min recommend wala nyanta ta ita booster ta so ni o booster ta nyanta ta every 3 to 6 months ekilinda every 3 to 6 months ekilinda pour kaminke ibala so yaro tara parering ni COVID jankaro kama because covid jang ko rabi janet because na last report o na last report o jang mo 15 years old on tan ni lul wala covid so jan so covid bi janne an han sa wa dunia because in last 2 weeks dunia be ay mo imurasi ada mo wuli kema flat so covid bi janne covid is still around so tol sa min geno wala we na kata ko wol ke la falo ka try gambian le tanga covid la pour ikana sasa covid because na sasa ta bataka war so nsawol keno pour ka gambian le tanga so on ko foten din ko covid vaccine wala public health facility to ni mo after covid vaccination wala ni dar public health facility ba tara jelo comme ani musa afanya because dula don le tan balti no sila kataje so o no sila ni kata in covid vaccine o binala so sasa tol mimba o lada ani mon mimbi jara sangi tan nim fulati wolti tan o mol yala pour kala kila vaccine ota so wala say wala strategy ku dodi minister of health lafta kam use pour yetara isembo yetara wala covid kam because kelol bakere so minister of health ba relax la bi isembo tara rek covid sawul no so wala na minister of health tol man tal sembo tara tol ni sembo ba tara covid kele kandoro.
Okay, Abrakabake Jaite. So this is for the two of you, Kamara and Mamanding. He's highlighted a very salient point. I think one of the challenges, if I can recall, in one of the sessions we had here, that was highlighted earlier is the issue of denials. Having people denying, the existence of COVID, or even, taking these vaccines. You have all these theories, misconceptions. The importance or the need for people to take these vaccines. I think he's really touched on a very salient point. Yes.
Yes. Thank you. That's a very important question. I used to say, we learn to trust one another. Imagine if you and I don't trust the teachers, how would our children be educated?
Yeah, true.
Imagine if you don't trust your wife, how would the food be prepared for your children?
Yeah.
These are facts.
True.
I mean, the health workers are part of the citizens. They are part of the families. And government has catered for every segment of society. This is what we have to understand. With security, we have Gambian standing there of security. We talk about education, we have our education experts. They are there. When you look at agriculture, the same thing. When you come to every segment of society being catered by nation. That's why we are a state. That's why we are a state. That's why we are a nation.
Yeah.
And today, Allah has destined that we, the same Gambian people, we are all Gambians, apart from the partners who are helping the Ministry of Health.
Yeah.
You understand? So we are the one responsible to protect our population through the health means.
Yes.
As we prove our existence as a nation. You understand? Understand things are happening in global. It's global challenge. Each time the whole world set up a solution to address a challenge, the Gambia have to contribute.
They have to.
You understand? Like even today we are here. Our viewers can hear us because of media communication systems. And we have ministry responsible for this also. Just to say that the Gambian people bear us assault. That we are Gambians like you. And it's our responsibility. We are the one that is hired by the state to protect the population through health means and strategies, preventive, curative, whatever. And today, let the people trust us. That as they trust when they get sick, they come for consultation. That every health plan and strategy that the government put on table is in the best interest of their knowledge. Is what is best for the country.
Well, I believe we all took the vaccine.
Yes.
And
And then I'm still fine. Also, Chief, like they say, you see, when talking to accept that you go in this country, let me say this Mandinka and Wolof. So we give an example. Immunization success stories is one of the proof.
Yes.
We have issues, what we call measles. Fusiba bejannu. I mean, tonja kurang bejannu. Ni lafany kurang bejannu. And how many people that measles claim their life in this country? They said, Mandinka said, let the speaker speak. Alone for
Yes.
Whatever beef, nothing of foja. Gambia bejane alone. For mu toya tipo manke toya. So fusiba ay mo jama halaki nyin sata ko. Polio ay mo jama fajan, tonja kurango ay mo jama fajan. But kabirim pengo kumasta. Kol keta nyadi bi. It's more than 20 years. More killing mangfa as a result of fusiba. More than 20 years. We don't have any official reported somebody died as a result of measles. And Utumo, around 1965, brother, they said then only 50% of under 5 reached 5 years. The statistics there. Go back to our data and you can prove whether I'm right or wrong. About 55. You know why? Because most of the world's vaccine preventable diseases, the tetanus, our elders are there. Jaralang. You understand the measles. Measles come every 4 years. It comes newborn, by next 4 years it comes. It takes everybody. If you have 10 children, hardly you have more than 10 children, 5 survive, 5 die. And that's why we have this Borototo, this what we call the Borototo in Mandinka, you know, Ituri Radal, Itotala, you understand, Suntukung, Ala Inde in Pular. You understand. So these names come as a result. Our elders are here, they know what happened.
It's true.
You understand? So these are facts. But when the country come together and they trust the health workers, and the result today is for many years, we have not had people died of meningitis. For many years, we have not had people died of diphtheria. People even know, Nendim Boyo, Jarlankura, Malo. Kunun Kebali Alone, Namamanyole Alone, but say more, Delmanolo.
But now, social media for an contributor.
Jandi Putana water, come Musa coming for Honeybee, Surtuna Musudimbal, Be Hakilo Bulandra, Sanji Dantan Comanto, Konobayo Kadinwal Batandi. Fo musol kata korda to korda ka sada dani ma no le fo ka tabimbe do kon malum fo mbe nga kala ni ya domo e ka bori min tuta ko ma ko bori pour e kana las fentem fo kono bay jaw bari biring rota pengo nati pengo mi yalon ko wala ka dinni wol tankandi kono bay jaw bi moti jam min ka musol je tabiro lambe do kon woto nyulmu kulati mi yalon ko ay diamu banne evidence is seen. Andung nka min fo ntol be mu banku dingol lati mbamal bijanne mfamal bijanne dingol bijanne andu na dimbal bijam mandula soto na manka gambiat oto gambia la kanu wala tinna nga duladol bulan ko mbatun tol ngata jata kende ala fanna do e dulado jibe ko mbatun ngata karandiro la fanna do ko mbatun ka journalist so e ba jela ko nimbe kafuta nga katoke nsanyin tabulo nyorandino mota kolyala goto ninko banko eta nyato fo be sa kafule momo be lori ndame yeje mutaay bamba andu lanoye wara because ngam min fo surtout nin dina mol fango be kacala on corona ngam mina fo ko kila sallallahu alaihi wasallam ndol mil bija mo nyamaje bari kibaro le futatamma andu lata ko wolen kibar kendoti nga limaniya sotoje ngata woto imu misrim moto wala mu cristiano to la dino mu landolti nyanta kallale woto dil landoto ko ko woti nyata andu bankote do kunola da mantam malla andu bi karafo ben to labul sama milka balang asake dingolu yana pala soto silang abakela nyaadil woto mbadingol nga ñoo fasa atol la mun tolla boss ñolti mba tolle jang wulati na wati nal kanan ka kacha ka jube be kafula ñola ñame be ñoo hakilo jurwandi la ñaadire ka je ko jata kende asa sabati no ñame woto mballa do ko le kan andum ni mom moy hakil ñimma soto mi ya lon ko ilafta nga kafunna do ko to isaje nsa futano mulma ñame ke tankandi surtout ñin tankandir pengola isa walino isa tano leptanto isa 1025 call nola wala isinano ministry la bundato nal sa kacha wala fisiata dina mbe sila mbe kumol fola mili yalon ko man sabati andu waka jata kende ala nasindi andu kurang bijam musa ya folen dayno keleta atata fameta man dayno je bari in 2020 nga dayno kurang soto jam fonga pengo ke that's polio. We had a campaign because the disease was seen within the environment. So ibajela ko nin kata kuwol ben nasi kandoro ibajela kurangol nga milikele iba murranan andu ni mo kelendi foya lamfundi ndaba wulana abe ni symbole bina andu natra man simfalandi ibajela mba a nyamoto kelela nyame akanta mantoro natina andu bingalo ne ko sasabe sasato minka mun tako polio tonja kurangol naye ma aka fenna tuy bala mi yalon ko asela moya na sindi nole andum be laftale na dimbal milbe kuma ifanansela kato lafa jata kende national development woto fengo fembe jata kende a sabatinde la ntolle na albe dending ala ngam bulo di nyola nga katoke ngaje ko jata kende abe sabatela nyama
mama just to add for our viewers in wolof mbokay alhamdulillah comme nuñ ko waxe rek si jël benen bi tay ñun Ministry of Health programme bu yoré vaccination bi expanded program on immunization ak suñu ay representative from the director of health promotion and communication ñun ñoo fi ñëw tey di waxtaan ak yéen si jàppale UNICEF ak nguuri Japanese government alhamdulilah comme ni ñu ko waxee ci kàllaame English ak soose jubluwaay bi nag mooy waxtaan si affaire pengu corona bi comme si gannaaw dañ doon ñëw ay campagne waxuñu ne campagne jeex na waaye fi mu ne nii dafa wàññeeku lool te fi mu ne nii mbootaay adduna bi ak nguuri Gambia Ministry of Health also dañoo ñëw ak ay jéego yu ees pour gis ne dafay continuer waaye nag lii nekkul lu ees soo xoolee feebari cere lu ñuy wax ngas lu soosee lu wan tonjaakuram meningitis ak yeneen feebar polio yëpp nii la commencé woon feebar su ñëwee dafay ñëw feebar bu mag dafay rey ay yu bari waaye bu ñu demee pengu jéego yu bari su demee ba am fu mu tolloo léegi dañuy dem su ko defee mu nekk lu nga xam ne dafay continuer si lu ñuy wax si routine service lay bokk moo tax ñu ngi dem noos weer bu nekk ñu ngi pengu xale yi di leen pengu pour musal leen feebari cere ak yu mel bokk na si tey ñu ngi pengu fukki ak ñeneent yoo xam ne ñu ngi koy jox si doomi Gambia pour musal leen feebar yu bari léegi corona bi itam noonu lañu continuer tey am nañ lu ëpp juróom-ñetti fukki loxtaan ak juróom si réew mi ñu nga xam ne weer bu nekk ñu ngi def immunisation ñoo joxe pengu pour fagaru bi ñu ngi ko joxe si lopitaan waaye am na itam lu ëpp juróomi ñaari téeméer ak juróom benn fukk sessions bu nga xam ne mu ngi am weer bu nekk weeru guraam dañooy taseek ak community suñ population bi si juróom-ñaari téeméer ak juróom benn fukk sessions si réew mi yëpp comme ndaw na ku nga xam ne na dem kilomètre mbaa ñaar mbaa ñett balaa nga am fu nga xam ne am na si weer bi fu ñu tasee pour jël pengu fagaru yi léegi corona bi nag fi mu ne nii foofu la toll incha allah dañuy continuer di corona bi léegi mu ngi fi wax na ne corona bi léegi mu ngi fi comme nu feebari cere bi mu fi nekkee wala ngas bi corona noonu la fi nekkee ñun nag dañu nekk programme boo xam ne ñun la nguuru sas pour ñu gis ne doomi Gambia ak gani Gambia aar nañ leen si feebar yu mel ni kon léegi jubluwaay bi mooy dañuy continuer di joxe pengu bii nii suñ demee noos ñu jox ko képp ko nga xam ne mu ngi am fukki at ak ñaar dem si kaw yëpp mën nañ jël pengu bi war na góor gi tam ñu am booster waaye bu rombee force du booster bi léegi jubluwaay bi mooy ñeenti weer ba juróom benn weer bu nekk lu ñu ne high priorities ñu nga xam ne corona su leen laalee ñoom ñooy gën a faat ñoom lay gën a sonal dañuy wax ne si ñeneenti weer bu nekk wala juróom benn weer war na ñëw tase ak ñun jël pengu bi si fu ñu demee noos noonu wala si lopitaan yi nga xam ne government lopitaan la am neen plan yi tal incha allah dañoo engage private bi comme Mamadou mu ko waxee si kàllaama sos si kanam dañ jéem a wax nit ñi itam fan si private su xam ne fu ñu demee mën nañ fa amee pengu yi nii ñu ngi doon laajtee nag lan moo tax ñu war a def lii ndax lii nekkul lu ees laajtee neen fii itam lan jéegoo nañ def pour population xam ne bokk na ci mooy waxtaan ak yéen jotaay bii bokk na ci tey pour ngeen xam jéego bi neen tëddal pour def pour ñun yëpp ñu jàppale ci waaye lii du mën a dem su fekkee ne xóolu xante wuñ waaye jaayte wax na ko fi waaye fi mu ne nii nag gars yi ñu ne weerante jaal mooy muuñ rek am na jaal amul jaal si muuñee rek mu set lu bari lañ waxoon fii si commencement bi si affaire corona waaye léegi leer na ñëpp xam nañ noonu lépp leer na tey so kon lu fi nekk amatul wax naa ko fi si kàllaame English affaire mooy dafa ñu xóoluwante nguur nag mu ngi bàyyi xel ci bépp fànn réew mi moo tax ñu ne ñu réew si wàllu agriculture am nañu fa toogal réew mi wala wér-gu-yaram lu mel noonu tey su fekkee ne xóoluwante wuñ ndax suñu xale yi dañ mën a jàng ndax suñu xóoluwante dañu mën a bàyyi dépense si gannaaw soo foo ñu xóoluwante tey ñun suñu seen doomi réew bi leen te ñun bugga naa ni di dexeral ne képp pexe bu nga xam ne buñ ko teddal si table bi ministre teddal pour lu nga xam ne dañu war ànd ak yéen dañ ko war a jàppale ndax xam ne loolu moo nekk lu nga xam ne loolu mooy jàppale réew mi ndax ñeen sa doom mi waaye ñu ne feebar yii nii nekku teel a commencé feebaru ngas time boot fay ren ñu ne 1965 fekk na ku amoon fukki doom si réew mi fii juróomi dañooy dee balaa juróomi at lu ko waral nag mooy feebari jàddaaral feebari ngas bi ak feebari lu ñuy wax jaralang totanos temps boobu xale yi su demee ba first 28 days bi da nga gis ne borom su doon nampa ŋayi lifin bi wow du mën a nampa du mën a jooy mu dafa dem de lu gën a bari ñoom su fekkee ne téeméer la juróom bi fekkee dañooy dee lii moo doon rey xale yi tey si jamono yàlla def ne bu pengu bi mu commencé tey naka la ëpp na ñaar fukki at amuñ feebar yu ñu ngi rey nit ñi si réew mi su ko defee ñu jàppalante rek incha allah te xam ne ñun yéen nañ fi nekkal tey yàlla def na ñun ñoo fa nekk ëllëg comme Mamadou wax ne ëllëg incha allah suñ doom yi la suñ doom yi ñoom ñooy toog si place di waxtaan ak réew mi su ko defee loolu naa bëggoon rek àggal ko si kàllaama
am na lu
jërë ngeen jëf
am na lu Jayte ak Mamadou waxoon si gannaaw
waaw
bëggoon yow itam nga déggalal ko
waaw
mooy affaire yi yaa ngi doon wax si affaire yi ñàkk a óolute bi
waaw
waaye bëri na ñoo xamante ne tey ñu ngi génne information yoo xamante ne
waaw
antuwut
waaw
nga dégg ñu naan boo jëlee vaccine bi nangam dina la dal li dina la jot wala vaccine bi amut wala covid amut ñu ko weddi te fekk xëy na teguñ ko fenn
dëgg la
yéen mi nga xam ne yéen a liggéey ci wàllum wér-gu-yaram ci buntu wér-gu-yaram ma bëggoon rek nga gën a dëgëral loolu ndax Jayte waxoon na ko
Mamadou waaw jërëjëf mbokk si nga loolu am solo la gis nga réew mi réew yi gum yàlla la Gambie dañoo ne réew gum yàlla la ayda da nga nekk christian mbaa nga nekk muslim soo gisee yàlla subhanahu wa taala dafa spécial oustaz borom xam ñu ngi may dégg spécial aaya la yàlla ñëw si Quran bi di teree tasaare information bu óorul yàlla moo xam ba doomi aadama yàlla wax na lii si Quran bi ndax yàlla xam na ne génération ñu ne système yi adduna bi yàlla dafa ko plan 50,000 years balaa mu ngi binda doomi aadama health system dana am communication system dana am media system dafa am yàlla li lay njëkk a palaan sax balaa mooy binda doomi aadama si boppam ndax yàlla moom diineem dafa xam-xamam dafa precede action Allah's knowledge precede actions so kon yàlla dafa ñu sas ne nit ki lépp lu ngay war a tasaare dafa la war a leer dégg naa rek loolu sax moo yàq si kër yi dégg naa rek mu tasaare kër yi mu tasaare diggante jabar dégg naa rek kenn du la wax dara ji nga si jamono corona bu mu commencé subhanallah masi no gis nga mbot baaxut gaa yi ñu doon wax ne gaa yi ñuy tasaare si loptaan yi pengu nit ñi si loptaan yi si base fekk na ñun fekk na ñu ngi doon xeex ak feebare ngas bi fii si Manjai Kunda gis nga nit ñi because kuy tasaare kibaar moom dafa am jubluwaay pour ise leen dem waaye neen bàyyi ne ñun neen ragal yàlla subhanahu wa taala lépp lu ngay def na la leer lu may ñaan Gambien mooy kenn bu mu nangu nekkam béy kenn mu naka mbéy te nguur comme nu ma ko wax ne dafa dépense man dafa pareel lu has ceetat ñu si angale for every segment of society need loolu si angal kat laa mooy nguur dafa pareel di yëpp tey su fekkee ne wàlli kaaraange la ndax dëkk la ndax community la su ngeen amee lu jaaxal dem leen si security ngeen laaj leen su fekkee ne affaire mbay la su ngeen amee any challenge any new information dem leen si agriculture su fekkee ne affaire wérgu yàlla ñëw leen si ñun su fekkee ne affaire wérgu njàngala dem leen si ministre of education su fekkee ne affaire environnement la dem leen si ñu am na responsable ndax doomi réew mi ñoom lay yàlla jox xam-xam yu mucc di taxawal réew mi si buntu yooyu suñ defee loolu suñ defee loolu duñ reeroo bu kenn nangu nit la yóbbu num la bugg a yóbbu ñun seen doom nen te yéen neen ñi fi nekkal pour di saaf
jërëjëf ñu ngi dese 10 minutes bëgg naa ñu dëgëralaat affaire yi stratégie bi gën ko bamtuwaat rek pour ñi nga xam ne na léegi lañ cuunen those who just tuned in, so they will also have the opportunity to know what we're discussing about. If you could emphasize again the strategy, because we have about 10 minutes.
Yes. So the strategy that the Ministry of Health want to employ now is vaccines will be available continuously like any other vaccines that we have in the Gambia. So it will be routine that they will be in our fridges waiting for people to protect themselves. So what the ministry usually does is every community in the Gambia is catered. Sometimes a day will be spare for by a facility to that community. The community, the health personnel will trek there, provide services. If need be, they return back to their main stations. So when they are going to those stations, they will go with COVID vaccines. They will be available with them at their RCH clinic that we usually call NOS in our local communities. COVID vaccines will be available with them. So populations that are above 12 years should go there to be vaccinated. especially for the 2 important primary doses. And we are continuously advocating for people who have comorbidities, health workers, to continuously getting this booster, because they are the priority group, because they are more vulnerable to COVID. Their immune system is down, and we know what COVID can do. It has killed more than, I can say, 7 million people.
Close to 7 million.
Yes, close to 7 million people across the world. So COVID is not just we all know what COVID can do. So that is why ministry has come with this. And there are also NCD clinics. Doctors usually have them, NCD clinics at the hospitals. So those NCD clinics, doctors will be engaged, and the strategies will be laid to make sure that doctors, vaccines are available there at the NCD clinic, so that those who are coming, the clients that are coming there regularly for checkups, can have access to these vaccines and be regularly updating themselves with their boosters, because this is what will keep COVID down. This is what will keep our comorbid people dying from COVID. So this is the strategy that the ministry is employing.
Great. Let me give Mama now. Yes.
Quickly, coming mbading lamura la ya fanyame, jeni bina eminfo mbe lamura la kakilu blandi lako. Bidiamu mu COVID-19 vaccination na bari na karin nos pengol fanan bijele andung bring corona nata nga kolya kul soto je fana katung amunta ko diamo mimbe kering ay mol nasindi ay mol bulo fandi ka finti kata ka pengo nyinta a nyama pengol ning bijele abentolleje aninna dimbal andu ngalon ko wululalu mbe kata ku jamala ke kan kaje ko mbenna dimba sabatinde la nyame anin dimba sa sewu wululal sa sewu anda abo sewu kono fana ngama jata kende ya kumata oto be ngomen se dimba la jata kende ya sabatinde wanyanta kala wululal la sulo oto nga kato la fa nga je ko karnin karwo kare surtout suutiyol nga musol kacandi nga je ko yeta nos ni fasa nga je ko be futara no nyame nos kundalto ke dingol pengo sota nyama andu so kono fana ne musol mutata mil fana bije isa mako ro keno ka je ko musoli dindingol futande leptano to ka je ko ye pengo sota nyama mbe ngalo ne dindingol la right siatal andu abeni right kono pour ye pengo nyin soto a nyama andu min fonka diantolier wulula kewo ya dingo parendi ay nanan ako nos bi nata ka na dingole nata aya pengo o kan se wonde bake andun kala fike itandi momola kan na kontanda itandi ba ngalon ko dimbayamu kewoni musol tate andun ila jata kende ala sabato mum bela nyantolti andun ninko dimba yurwa jata kende ama nyana nasila so coming omariya min fo al dalta jela ko watin ka finti nga fo assalamu alaikum nata corona pengola so lafta falindir kala wo system wala ko kutante ba ngalonne birin to nja courant keta sotota jang watuma abe sangararin nga nyin sim falleta ka je ko courant nyin sa sambano dulato mi yalon ko ala mantorobe talala andon abo kono ala natam fasa nga je ko nanyin karnin karpengol kamindi monthly vaccination against corona afanan nata wo yurwal nate katon sai sa sabi janne barala mantoro talata so sai ngamine parende ba ni ko Gambia ni ko Ministry of Health hani bi adabe duniyala kuwolle kono woto sartol ministers njata kenda jurwandi Ministry of Health fananda bu konole so be ferol lalandi kankaje ko momo mi ala siyobe sanjitan nim fula kata santo isita na leftan bundalto isa pengo soto do nyame ke fantan kandi corona la anila dimbayal aninka katoke kaje ko surtout mol mi yalon ko nyin sasala dol bela mil kam to ko sukur courant na kebalu ke futandi leptano to kaje ko yo pengo soto a nyama wala mun na singoti bari be murna nanne
inshallah yes
nin ala kititala na se kacha soto kacha nyin kono se fanu andu be muna fanna nyo pengola nyame o finansina woto mbadingol mimbe la moyrola nali hakili nyima soto kan sembentu yande kaje ko nsenna do ko nyi nyandi no nyame kaje ko jata kende ay sabati alsem wali wala le 1025 call wala ta any health facility mi yalon ko asutiate la ka kibaro dila inshallah kibaro be futalam mala ala baraka.
Welcome, Ake Mamanding. I'm afraid we've come to the end of the program. We have this video that we want to play for our audience. It's all part of the discussion we're having here. So if we could just maybe just say our final words. We have a minute. Yes, unfortunately.
So I would say in Fula, Musibe had the years that they got for vaccination. Hala to pronome Harini, Hala, he did the Fofco, Woni, continue to go Pengu, come no North, while any journey. Harai Pengu, affair Kovic or Kono, continent, Kono Burai, Arde, Lawol Gongo and Burai Pengu. Kono, Leuru, Sukakala, do be Joe, Yahonos, at the Pengu Jidin, Prudada, Nyau. Corona. Dandirtedo Pengu.
Thank you.
Okay, nda min fula dro wala Minister of Health mo kilon la mil bal ma ko kan jare kende ala. So wo mo kilon la ka falle ko tan ale tale ali pengolta. So mba fula molbi hansa o pengo kilon le pengol mil yaron ko buka ko ke mola ke tankande doron no so mo le finde doron eta pengolta.
Thank you. Mawandi.
Allah barka bake mbade la moyralo. Atolle mun tol sembote. Mbe siringa tolde jang woto mbal danila alba kato minna kaje ko bankola jata kende ay sabati nsa kato lafa mandu mbala fala nyadila wala kaje ko ngaleptanol walin mfangol wo na dimbal wo na dindingol min siyo be sanjilulu nga feroke ye la pengo soto anyama isaje jata kende ay sabati la barka.
Thank you very much, Mamanding. Viewers, I'm afraid this is all that time permits for today's edition. Our guests in the studio were Omar Jaite, who is a health communications officer at the Directorate for Health Education and Promotion, and we had Musa Kamara as well as Mamanding Kinte from the EPI unit. I'm afraid this is all we have time for, but we'll leave you with this video until we come your way next time. Thank you.
Nte to mu jawno kijeral tay wuli nyakoy tay watu nte nga corona penko kumo metu momenda nsilanda bari nko na mol be nko e janni be mol yamar la ka fali ngata ali be funti ngata corona penko ta ala jata kende a wala ka fadu kabir membe ngata jang moma sasa soto hani musu kono mali men yata jang ibeji kute dingil bebu woto kuna corona penko mobe fundi meni mata ye penko ta yata kendi asisabati katu corona ben fejanne ado ay mowol torale